It is September 10th, which means it's time for our monthly segment, KEZI 9 Checks In. It's a monthly reminder on the 9th of the month, or in this case, the 10th, for women to do a self-breast exam to check for any lumps or changes. And this month, we're also focusing on preventing cervical cancer. Here's KEZI 9 News anchor Renee McCullough.
Joining me now is Dr. David Herrmann from Women's Care, and Dr. Herrmann is an expert on women's health. And today we're talking about cervical cancer screening and prevention. So we're going to talk about first what cervical cancer is.
Yep, cervical cancer is cancer of the cervix, which is the lowest part of the uterus, it's a cancer similar to other cancers. It's the location of it is in the cervix. That's where it starts. So that's why we call it cervical cancer. But in terms of cancers, it's pretty similar. It will keep growing if we don't do something to stop it, and it can definitely be life-threatening.
Okay, is there anything that women can do to lower their chances of getting cervical cancer?
Absolutely, yeah, that's why I'm here. The main thing you can do to prevent cervical cancer is to be vaccinated against the human papillomavirus,
okay.
HPV. If someone's already been exposed to HPV, it could potentially be too late to get the vaccine. The main thing people can do is be completing their Pap screening, HPV testing by seeing their doctor at least yearly.
Okay, so and then how often should women get screened? You said yearly, and then at what age should they start?
Yeah, so we want to see everyone yearly. That doesn't necessarily mean we'll be doing PAPs or Pap screening yearly. That's a relatively recent change over the last few years, where screening, depending on the age or a person's particular medical conditions, we may screen as often as every 6 months for some populations, but in general, for women between the age of 21 and 30, we screen every 3 years.
Okay.
And for women between 30 and 65, it can be as infrequent as every 5 years.
And what should a woman do then if she has an abnormal screening? What happens then?
No, that's a good question, and it depends on what the abnormality is, and that's really where my job comes in, and tailoring the recommendations based on the abnormality. That could be as simple as repeating the Pap and HPV testing in a year. It's pretty common if it's not severely abnormal, but it could mean proceeding to cervical biopsies, or in some cases even treatment if it was cancer diagnosed.
Okay, what about pregnant women for treatment and for screening? What do you do in that case?
Pregnant women are treated pretty much the same for screening. How aggressive we are about doing biopsies of the cervix in pregnancy is different. We can watch a lot of things and delay things until after pregnancy. But overall, the screening is the same. And oftentimes that's when people are coming, our patients are coming to care, is when they have a new pregnancy. Right. So we usually are screening at the first visit.
Okay, and the HPV vaccine, it's for boys and girls, correct?
It is.
And when should they get that?
So anybody can get that starting at age 9, and if those populations get it between age 9 and 14, it's only 2 shots, which is nice. Otherwise, it's 3, or if we're catching up on the vaccine schedule, we're happy to take that over. And that's often something that a patient will get at their pediatrician office, but we do those vaccinations at our office as well.
All right, great. Thank you so much for joining us today. That is great information. And for more information on health topics, you can go to womenscare.com.
And be sure to go to our website to sign in for KEZI 9 News Checks In. Remember, we're going to send you a reminder every month to do your monthly self-breast exam.